Beginning in 1992, Hospices of Hope have introduced hospice and palliative care services into the regions of Romania, Serbia and Moldova for the first time. Today, they have improved the quality of life for thousands of patients. Now they are raising funds to expand the work into Bucharest, where there is currently no specialist inpatient hospice care for those who need it.
Romania is a country which is, in great need of increased support from a palliative care standpoint. What we have to realize that in Romania, there's about 75% of the patients that are diagnosed with cancer are diagnosed in terminal phase. That means that all these patients are sent home with very little support. And in fact, only 5% of these patients are actually offered the proper palliative care service that we are all accustomed to receive in developed countries, which is pain management, proper relief, proper psychological support. So the need is great in Romania.
I think in this day and age when the world is so small, for us to have the kind of suffering that I've seen in Eastern Europe is just not acceptable.
Without the availability of hospice care in Bucharest, many terminally ill patients are discharged shortly after diagnosis and left to fend for themselves. Patients like Marius, who is paralysed from the neck down and cannot move from his bed. Currently, Marius's primary source of palliative care comes through home visits from Hospice of Hope nursing staff. Another patient, Laura, is also bedbound and looked after by her mother at home. She too receives regular home visits. These give her and her family much needed medical and emotional support.
When you are in suffering, you need to know that a person cares about you, to know that someone is near, shoulder by shoulder, near you in fight with the illness.
When it comes about care at end of life, I think this is something which I think every human being can relate to. It is a need. I don't think it's different if you are a person in UK or if you are a person in Romania.
The planned hospice centre in Bucharest will have 30 beds and serve thousands of children and adults. The building will also provide a teaching centre, a day centre, outpatient clinic and house the home care team.
Having a physical center is important for a number of reasons. One, it's important because we need to service the patients in Bucharest. It needs to become a center for patients to come and be cared for. But it's an important base of influence for the cause because, again, we want to make sure we can use this center to influence politicians and also use the center to train healthcare professionals in terms of caring for palliative care in the future.
I think as it grew, the community would become more involved in it and become aware. And I think also then that would bring a certain pressure on the government to put in funds to help it survive, and it would be incorporated into their healthcare scheme. So I think it would have a huge impact.
București are nevoie de hospice în special pentru cei cu fibroză chistică, pentru că aici suntem cei mai mulți. În București sunt cele mai multe spitale cu fibroză chistică, cei mai mulți pacienți. Și în primul rând în București vin și din celelalte orașe. Sunt cei mai buni medici.
It was back in 2001 and I first got involved in the hospice in Brasov. I know I've made a difference. And I have to tell you, none of us can make that difference, not for the patients, not for the workers, without money. Please give as much as you can. Please make that difference.